Hi, the article that caught my attention was about predicting opioid use disorder before and after the prescribing peak in the United States. It was predicted by using machine learning. Um, so, the opioid epidemic is a serious problem in the United States, has been over the last couple decades. And if they're using machine learning to predict something as important as opioid use disorder, it got me wondering what else have they used it for already in healthcare? The answer is several things. So, just to name a few, they've used machine learning to predict a system for somatic fitness. They've used it for lung cancer detection. They've used it to predict the future mental health services being utilized. They've used it for augmented reality for phantom limb pain. They've used machine learning for identifying factors that may predict hypertensive heart disease. They've even used machine learning to predict high cost patients in healthcare. So my point is, it's already been used for lots of stuff in healthcare, and since it's being studied across so many different areas of healthcare, it got me to thinking, like, what's the problem with this? Are there any concerns? Are there any downsides to using machine learning so far? Um, the answer is yes. So there's a need for a lot of high quality data, or else algorithms can't be trained properly in machine learning. It might not seem that difficult, but when there's a bunch of data being transferred from system to system to system, the data's integrity can definitely be compromised. Um, Number two, you got to invest in a bunch of training before implementation because there's such computational complexity. Training is always a problem. Training takes time, training costs money. Training is identified as an issue, some kind of inconvenience to employees that feel that they're already trained. Um, so training is just a concern. Um, Number three, so the interpretability of machine learning, it's concerning because the difficulty to understand how machine learning arrives at its prediction. It's easier to comprehend answers if you know how and why you came to that conclusion, period. Um, so number four, machine learning, this technology has got to be updated regularly all the time. So there has to be some kind of framework for the software's oversight. Absolutely, that's probably number one. How many of us have had problems with our phones or our laptops not being updated regularly or properly? And this is concerning because this stuff, we're not talking about a phone here. This stuff is in healthcare now. So, what if you have some type of device on your wrist that's supposed to alert you? What if your heartbeat changes and you're supposed to go to the emergency room right away, but your device doesn't alert you because it's not updated and you die? That's scary. That's a huge concern. Um, which leads me to my next concern about machine learning is the fault might not be clearly attributed to the healthcare practitioner when using machine learning. So our patient right's going to be an issue here. So therefore, there has to be a coherent human rights centered policy framework built around everything concerning machine learning. Any type of artificial intelligence, robots, any type of related technology has got to be included in that framework. So that's just a few problems I came across when researching machine learning. Are there any solutions to this? There's got to be medical experts involved in the analytical process because, like I said before, if you comprehend things better when you know when, how, and why you arrived at that conclusion. So if the doctors can't describe the logical reasoning behind what's going on with machine learning, then who is going to interpret that information to the patient? If the doctor doesn't understand it, then who is going to understand it? So I definitely think there's a solution by involving the doctors as much as you can in the analytical process while using machine learning. And is this important? Absolutely, because people's lives can be saved here. It's equally important because people's lives may be at stake because of machine learning. So I guess my research question with the research that I've done so far is, what is the best way to use machine learning for everyone involved, especially the patient? And I think It's involving the doctors and a hybrid use probably of humans plus artificial intelligence to be able to implement machine learning in the best way. What is the best way to implement machine learning in the future?